Rare conditions are often lifelong and complex, and as a result, patients and their families need care from a range of different services. And it's the coordination of that care that can make all the difference. In this report for Genetic Alliance UK, we find out how well-coordinated care has been life-changing for a family of a patient with Alström syndrome.
And this is Hassan?
Absolutely,
yep.
Yeah.
Cool.
That's my young man, Hassan.
Hassan has Alström syndrome.
He's a young, independent young man, very active in terms of his lifestyle, loves the outdoors, loves cycling, loves going to the gym.
This rare genetic condition has deprived Hassan of sight and a normal life expectancy.
He was diagnosed with Alström syndrome when he was 17 years old, so that was quite a late diagnosis. But actually from a very young age, we sort of felt things weren't right for Hassan. At the age of about 16, he just woke up one morning and said, "Dad, everything's quite dark, I can't see anything."
This is one of these really rare conditions. It affects about 1 in a million people altogether. Children are often born healthy and well, but by the age of about 6 weeks they get wobbly eyes noticed by their parents, and on vision testing it finds that they've got a severe vision defect. About a third of these children then develop heart failure in the first 3 months of life, and sadly some of them don't survive from this, but those that do then go on to develop a particular pattern of features that includes early onset obesity, hearing problems, vision loss leading to blindness altogether, and a range of other health illnesses that means they're very dependent on hospital services. They ended up having to go to one hospital for an eye doctor, another hospital to a hearing doctor, someone else for a heart doctor. It was just very, very hard for them. So we set up this service called a one-stop shop, where all of the hospital specialists would come together on 1 or 2 days for the families to come and see all the specialists together in one occasion.
That's what happens here in Birmingham, where Hassan and his family meet all of the clinicians helping to manage his condition.
From a carer's perspective, having a team who you've got direct contact with takes the burden off completely. Because if I've got a challenge with my local clinicians around a repeat prescription, for example, the clinicians communicate with each other and the connection is made very quickly.
This approach to treatment, called care coordination, helps clinicians work more closely together, reducing the risk of medicines prescribed by one causing problems for another.
The example at the moment that works really well is a young person comes up and they're getting bad headaches, and somebody wants to prescribe them a non-steroidal anti-inflammatory drug, but the kidney doctor is there and says, well, please don't do that because they've got kidney problems and that would harm that.
Care coordination also brings families together and helps them to share experiences.
Because it's so rare, families from around the country don't know anybody else with the condition. So bringing everybody together in an opportunity allows the families to actually give each other peer support. We try and age band them so that children under 10 are all seen together and then teenagers are seen together. And I think the families get a lot of emotional support from that.
In terms of the complexity of the condition and what that means in terms of day-to-day impact around need, around care, all of a sudden you add this tribe of people behind you who are endorsing in what is required in terms of that care package. So it's been really positive.
And working together raises awareness and improves understanding, leading to better outcomes for patients and their families.
What I can say is that since the clinics were started in 2008, children are now graduating to adulthood in a much healthier state than they would have done 20, 30 years ago. So I feel very hopeful for the future because of the better coordination that we have.
This is a very progressive condition. We've had conversations with clinicians about life expectancy, which are very difficult to have. However, because I believe in my faith, death is inevitable for us all, and I don't really we take each day as it comes in the most positive way as possible.
And care coordination is certainly helping Hassan and those like him with rare conditions make the most of every moment and enjoy family life.